us for today, the May 31st, 2021, which just happens to be World No Tobacco Day. I'm your host, Rihanna Ramsey, and joining me via Zoom for the next hour or so is Dr. Indira Boj, Registrar of the Family Medicine Unit at the Georgetown Public Hospital Corporation. Dr. Boj was formerly attached to the NCD unit, which is the non-communicable disease unit of the Ministry of Health, and she will be sharing with us on the dangers of tobacco use today. Good day and welcome to the program, Dr. Boj. Dr. Boj?
Hi.
Hello. We seem to be getting a little bit of technical difficulty. Just bear with us, all those who are joining us via radio and Facebook today.
Hi, good afternoon.
Hi, good
How are you
afternoon.
doing?
It's good to hear your
Yes.
voice.
Thank you
So
for
today
the
is...
opportunity to be here today.
Mhm.
And first, let me just apologize for my surroundings. Because the only quiet spot I could have found is the department is quite busy right now. But
It's
I think we
okay.
should have a
It's okay.
productive
I'm sure people will
conversation.
understand that you're a doctor and you're on call, and doctors are quite busy, especially around this time with COVID and everything that's happening. So before we go into our program, today is World No Tobacco Day, and I just want to share a tidbit for those who are not familiar with some of the things that we are going to be discussing. This is something from the World Health Organization in relation to tobacco use. It says that tobacco is responsible for 7 million deaths, at least 7 million deaths per year worldwide, and that includes 900,000 persons who die from diseases related to exposure to tobacco smoke. If the current trends continue, tobacco use will kill at least 10 million people every year, and 70% of those fatalities will occur in less developed and emerging nations like ours. Guyana, up to 3 years ago, has been a nation where 78% of all deaths were caused by non-communicable diseases, or NCDs. Sorry about that. And strongly related to tobacco use. 15% of the adult population, currently smokes. So, Dr. Bode, you have quite a lot that you can shed light on here today, right?
Yes, definitely. It's a very, very broad topic and timely as well. Those statistics are staggering. I mean, you can begin to compare it to COVID, and we see the devastation that it's causing day to day. But this very silent pandemic of tobacco use is really needs to get the attention as well. Mm-hmm.
Okay, so for those persons who are not familiar, tobacco happens to be quite addictive. Could you tell us what makes this product addictive?
Okay, so one of the main ingredients is nicotine, and nicotine has specific, without getting too technical, specific effects on brain function and mood. And so people, like other addictive substances, their general functioning, brain functioning and nerve functioning becomes dependent on nicotine. So this can become a very addictive substance because there is immediate payoff. The feeling, the hit of after smoking is an immediate payoff to smoke. This is why people tend to want to experience that feeling again and again.
So it's the nicotine in the cigarettes that gives tobacco that push.
That's right.
There are not, besides cigarettes, I understand that there are a wide range of tobacco products out there. Could you enlighten us on some of those?
Traditionally, cigarette has been a part of many, many cultures. I remember looking at Indian movies back in the day, and you will see the men chewing tobacco leaves in the Indian movies. In the Hollywood movies, it's smoking cigarettes. so throughout recent civilization, tobacco is really widespread in different cultures and in different forms of use. In Asia and the Middle Eastern countries, there is something called the water pipe and hookah. So there are so many forms of tobacco, and keep in mind they will all contain the nicotine and other substances in the tobacco, so that people are now able to do tobacco is an immediate hookah. Yes, and the forms are very, very varied. People can choose not to smoke anymore. One of the emerging uses forms of tobacco use would be vaping or e-cigarettes. So that what is emitted is not a smoke; it's a vapor containing just as dangerous chemicals. The water pipe, the hookah, snuff tobacco is a form of tobacco that can be inhaled, kind of how drug users use other drugs. Tobacco also can be inhaled, and so you name it. Tobacco producers and the tobacco industry is getting creative in how to present the tobacco for different tastes. There's flavored tobacco for hookah. There's flavored cigarettes. Wow, there's so many forms of tobacco.
And while we're on that topic, a lot of people in Guyana know hookah seems to be the new form of smoking entertainment in a lot of clubs and so on. And they're using it. And they don't feel that it's dangerous. Could you speak to the danger, the risk factor associated with that?
Okay. Right. So there is immense evidence and enough research for us to know that any form of tobacco use is dangerous. People tend to think, oh, it's the smoke from the tobacco. Just to say there that the tobacco smoke contains about 70 chemicals that are known to be cancerous. However, the smokeless tobacco products are just as dangerous and have quite as many chemicals that are cancer causing and have other dangerous health effects. So that the forms of tobacco are geared towards people feeling that they're using a better form of tobacco and that also it's a normalized way of using tobacco. And there's also the hookah that we think, okay, well, this is just hookah. Some people say the hookah doesn't have any tobacco in it. So one of the things that we usually talk about are gateway habits or gateway drugs. And so just by normalizing the act of pulling in that smoke from the hookah, it kind of opens the gateway to try the next step, which is hookah with tobacco. So in all forms, we do not encourage use of tobacco carrying devices or any tobacco carrying products.
And we know that smoking tobacco has led to in a number of respiratory illnesses. Cancer is one of them. Well, not a respiratory illness, but that's another ailment that people get as a result of smoking. What are some other health complications, and how long does a person have to smoke? Some people feel that, okay, if I take a cigarette now and then, I probably wouldn't get sick. How long does a person need to use the substance before they can actually have an effect? It can actually have an effect on their health.
All right. So that's a two-part question, and it's two really big parts. I'm glad you asked. So the first thing I would say is concerning the health effects of tobacco. It's not just the nicotine; it's all of the substances that are contained in the tobacco product. Let me just name a few. I've listed some of the most important ones, if you don't mind me naming them. We have the nicotine, we have hydrogen cyanide, we have formaldehyde, which is a preservative. Then we have heavy metals such as lead, and we know that these tend to cause cancers. We have arsenic, which in some forms is a rat poison. We have ammonia, benzene, some radioactive substances. There really is, the list is extensive of dangerous chemicals within tobacco products. And so when you think about the health problems associated with tobacco, it's not just the lungs. So we have persons with chronic obstructive pulmonary disease. We have persons with cancers. And it's very important to note here that both female cancers, male cancers, and general other types of cancers are related to tobacco smoke. So that you have prostate cancer, you have breast cancer, you have the typical lung cancer that people are tend to focus on. So the health effects, and apart from the cancers, nicotine is very bad for the blood vessels and the heart system. So we call that the cardiovascular system, right? And so nicotine is one of the major risk factors for a cardiovascular accident, such as stroke and heart attack, and even high blood pressure. So people don't usually make that connection that, okay, this person I know had a heart attack, or this person I know had a stroke. Oh, how unfortunate. Somebody may have died of a stroke or heart attack. Oh, how unfortunate. But then they don't make the link between the day-to-day smoking and that ultimate health outcome, right? So we have to understand that link and sensitize people to that link. That something as innocuous as smoking one cigarette a day, that's the research, even if it's one cigarette a day, can have these really bad health outcomes and disability problems. So we know, for example, persons who have leg amputations, and it was not due to an accident or an injury. Most often, it's due to very poor blood supply in the legs. And in my experience working at the Diabetic Foot Center and having to unfortunately call some of these amputations, like decide on some of these amputations, we have seen that a lot of people have a smoking history, right? So the health effects are extensive and throughout the body because of the various locations of cancer and because of the detrimental effects to the entire circulation, the cardiovascular system, and these are all outside of the respiratory system. So that's part one of the question. And the other thing that we haven't talked about is the actual illness of the addiction, so that it impairs a person's function, it affects their family life, it really affects their budget, how much they're able to spend, how much they're able to invest into other things, so that their life kind of revolves around feeding an addiction as well. So that really takes a toll not only on their physical health, but on their mental health. So coming to the question of how much can a person smoke, and that's a safe level, or that will determine that they will get an illness. In the medical field, we have understood, and we are saying it clearly, there is no safe level of tobacco smoke or tobacco use. And one of the reasons, and I think it's a very important reason, is because people who have never smoked a cigarette in their life are still within one of these categories of first-hand, second-hand, or third-hand smoker. So even though I may choose not to smoke a cigarette, I may have been a third-hand smoker for a long time, and I hope you'll ask me that question to explain a little bit more. Sure. So, in a sense, we have all been exposed to different levels of nicotine and tobacco chemicals, these combustion chemicals, for a long period of time without us knowing. And there's a lot of evidence that this also has dangerous health effects.
Well, as you mentioned it, what is, we know secondhand smoke is when somebody smokes and then you're the person who's in that environment and probably inhale. What is third-hand smoke? I've never really come across that term.
Great. So let me just cover the bases here. First-hand smoke is when the person directly smokes the cigarette. So they're inhaling the smoke. It's in their direct environment. It sits on their clothes. It sits on the chair that they're in. It sits in the vehicle. It takes rest on all the surfaces, especially fabric surfaces that are not cleaned and washed off. So that would be the smoker, the first-hand smoker. The second-hand smoker, and this is also for smokeless tobacco products, because the smokeless tobacco products, they do give off a vapor, a water vapor, or a steam vapor. So that even though the secondhand smoker doesn't inhale a smoke, they're inhaling vaporized chemicals from this e-cigarette or whatever other smokeless tobacco product. So the secondhand smoker is the person who is around the smoker at the time that the activity is occurring, so that they inhale directly some of that emission, right? And so they get the it's like they're smoking but not directly. And then the third hand smoke is all the dangerous chemicals that have been formed by the combustion or the vaporization process of this tobacco product now sits in the environment that that person was in. And so if somebody comes and sits and touches that environment, it goes on their fingers. So it's now in contact with their skin. Let's say they bring their fingers to their face or to their mouth, they can ingest it. And so third-hand smoke really started to gain attention around 2009 and 2010. And I don't know if the audience can make a wild guess in which age group they really focused on that persons were getting sick. It was the little children. Because the little children in the home, they interact with their environment by touching. An adult might sit in a chair and never put their hands to the chair. You know, little children, hands in their mouth, then it goes to the surface, and then hands in their mouth again. And they're playing on the carpet. They're touching a lot of things. So a lot of research was going into children who ended up sick in the emergency room or in hospitals and had frequent visits to the hospital. They were actually studied, and I think in one study, the levels of nicotine on their skin and in their blood was about 3 times higher than the than the children who were not exposed to third-hand smoke. Right. So the third-hand smoke is pretty important because it seems to be concerning the little children a lot more.
Wow. That's interesting to know. So people out there, when you're smoking, you need to be cognizant of the fact that you have not just secondhand smoke when you give off the emissions, but what was left, the residue of that smoke, of that tobacco use, the vapors, they can also cause harmful effects, especially to young children. As we're talking about smoking secondhand and third hand, in terms of being protected, how can persons, because let's say a parent smokes and he tries to, no parent willfully exposes their children to harm, so they're not too careful, but now that they know that it can harm their children, how can they protect them? Is there a way that, okay, you can protect your children from a smoker in the house or a smoker at your, you know, in the public?
Look, my best answer to that is the person needs to quit. Because if you're ensuring the safety of your children, you want to be able to be a healthy parent. The research has shown that persons who are smoking, their lifespan is about at least a decade shorter than the non-smoker. So when you're thinking about ensuring your children's future, I would advise right away all parents to not smoke. We want to safeguard public spaces and even homes. And this is why in our tobacco law, there is a strong emphasis on where smoking is permitted. Because once smoking is permitted in that area, then that residue is left. And so even if the smoker leaves, the place now is not a smoke-free zone anymore. It has these emissions. So we have the culture that somebody would send the person out of the house. Okay, you go smoke outside, right? Don't smoke inside. The children are inside, or I'm inside, or whatnot. But that person, when that person finishes smoking and comes back into the house, they're bringing all of those chemicals on their clothing, on their body. Really, unless all of that is washed off, it eventually gets into the in the home, into the fabric of the furniture and so on. So really, there's a lot of care that must happen for people around us, and that's why this is a public health issue. That's why there's an international law regarding this, the Framework Convention for Tobacco Control. Because this is not, we can no longer say, okay, the person chooses to smoke, they're going to bear the consequences of their own habit. It's no longer that. We are seeing that the effects of secondhand smoke and third-hand smoke are really dangerous, and it's hard to create those zones of those smoke-free zones. Washing is a way of getting rid of the tobacco emissions. So things like couches and carpets and curtains and so on, it's kind of impossible to get them,
I know.
To keep them smoke-free if there's a smoker in or around the house.
In terms of, so there's basically nothing that you can do except quitting. And I know that you mentioned that tobacco is a highly addictive substance earlier. So quitting would be probably take a period. It would be a process to quit. I'm not sure, but can you answer this question? There's a question about filters, using filters in the cigarettes. Is it possible that these filters can help in terms of helping to protect you against the risk of getting sick and so on?
No, actually, because even if you use a filter on the cigarette, you're still inhaling the combustion chemicals from that cigarette. That's the smoker, right? And then there's still all this stuff on the smoker's body that gets inhaled eventually. So using a filter is nowhere safer, and that's something that the tobacco industry has been trying to suggest or trying to offer as options, right? So now you have the hookah, now you have the e-cigarette, now vaping, and then the filters or whatnot. So that there's so many different ways of using tobacco that's not the traditional smoky room or smoky person, that people now feel it's safer, but no level of tobacco exposure is safe. So really, these are just preferences for the user, but it will not safeguard them from any ill effects of the cigarette.
Just before we go to a break, when we want to quit, if somebody wants to quit smoking, what access do we have to medication? What's the type of quitting process that we can undergo in Guyana that is accessible and easy for us here? Well, accessible, basically.
Right. So what I would say to that is that the Ministry of Health is aware that the access is limited, especially where it concerns the interior regions, the coastline regions. In Georgetown, it's a person can see a psychologist. A person can have access to drugs for smoking cessation or nicotine patches or gums, especially if they have the insurance coverage or they're able to pay for it. So that's not very difficult in Georgetown. However, the access is limited throughout the country. So the Ministry of Health is looking at incorporating strategies for helping persons to quit, whereby doctors in our local health centers would have the counseling tools, and not only doctors, the primary healthcare team will have some of the counseling tools that's necessary to help a person to quit. So there is the part of psychologically preparing that patient, and most times that gets it done without a drug. So that once there is psychological support, psychosocial support, and the right type of counseling, then the person can go through this process of smoking cessation successfully. However, where it concerns getting the medications, that's a bit more technical and difficult. So this is a work in progress, and this is one of the areas that we would have to take a look at and to continue taking a look at. I know within the last month, we have worked to organize this sort of training for healthcare professionals. So even as we make that, even as we make headway in terms of the tobacco law implementation, this is one of those areas of care in the health system that we're bringing on board also.
So it's not unnecessarily cheap, as we would say, to quit smoking in Guyana using the methods that are universally known, like the nicotine patch and so on.
Right. So there's a lot of misuse of those options, the nicotine patches, the nicotine gums, so that a person is more likely to be successful to quit if these nicotine replacement therapies are accompanied by the proper psychosocial support. Right now, our psychosocial support is specialized to the drug dependence reduction healthcare workers, who are the psychologists and the 1-2 specialized NGOs that we have working in the area of substance use. And what we're going to do, and the approach we're going to take, is to enable more healthcare practitioners to be able to provide that support, that psychosocial support, because very often the nicotine replacement is not necessary.
Okay. So thank you, Dr. Boach. We're going to just take a short break, and when we come back, we'll continue discussing. And welcome back to your Health Matters on Kaieteur Radio. Today we're discussing the dangers of tobacco use, and we have with us Dr. Indira Boj of the Georgetown Public Hospital, and she's just given us some insight on the dangers of the use and what we can do to help protect ourselves. Dr. Boj, are you back? Hello?
Yes, I'm back with you.
Okay. So we were discussing the lengths, we were discussing the... Hello?
Yes, I am hearing you.
Okay, I was wondering. We're discussing tobacco use, and one of the things that our country did a few years ago to help control the harmful effects of smoking in public, you mentioned it earlier. You mentioned the National Tobacco Act. Could you give us an update on some of the progress we made in terms of implementation, if you can?
Right. So to start off, let me just give a background of the act. The Guyana Tobacco Control Act, which we ratified in 2017, is based off of the Framework Convention on Tobacco Control, which is the WHO Public Health Treaty concerning tobacco. And this is pretty important because the world recognizes that tobacco use is dangerous, not only to the user, but to public health and to every citizen who may be exposed. And so today, the theme for today is Commit to Quit. And really, internationally, we are looking to have a smoke-free world. And so based on the Framework Convention of Tobacco Control, we have more of these regional commitments and framework. So Guyana has committed to the regional framework for tobacco control, and our law kind of mirrors or contextualizes the basic principles and elements of the FCTC. There are many aspects to this law. There are aspects to producing tobacco within the country, importing tobacco, taxes on tobacco, how tobacco is to be sold, presented, and how the citizens are protected, the smoke-free policies within this law. So there are many parts to this law. So it's really comprehensive, and a couple of the more important points would be the comprehensive ban on tobacco advertisement, promotion, and sponsorship. So I think that was one of the major achievements coming out of this 2017 law, which an amendment was added to it in 2018, and that was specifically geared towards producing the framework for the packaging and labeling of tobacco products, especially for Guyana.
I understand there is a task force of some kind that is helping with the implementation. Could you speak to some of the areas, because you mentioned the packaging and labeling, some of the areas of focus and how they're able to help in terms of implementing those guidelines, those regulations?
Right. So soon after the Tobacco Act was ratified in 2017 and the packaging and labeling regulations were finalized in 2018, the Ministry of Health took on the major task of sensitizing persons, the tobacco industry, even the implementation agencies on what the law contained and what the packaging and labeling regulations were like. And so we have made headway in terms of the packaging and labeling, that if you look at our packages, each pack has about 60% coverage with a graphic warning label. And that graphic warning label is a dramatic, well, actually, no, it's not a dramatic. It's a real picture of diseases and health effects of tobacco. So very, very strong on the part of the law that concerns packaging and labeling. And coming out of the law also, there is a stipulated statutory body called the Tobacco Control Council. I believe that's what you're referring to,
yes.
The task force, right? So the Tobacco Control Council really brings together all those agencies and even non-governmental organizations represented in a way that ensures that tobacco control isn't partisan, because there's a lot of room for partisan transactions or dealings or permissions within the tobacco industry, so that the government must do as best it can to ensure that the tobacco control of the council of the country is representative of everyone's needs and contribution, and so there is no it's a level playing field, and there is no way for the tobacco industry to interfere. So that council was established sometime in 2019. one of the major challenges was that in 2020 the COVID pandemic hit, and so a lot of the work that should have been done in terms of sensitizing people concerning the law, working with the enforcers of this law, had to be delayed. I'm happy to say that we restarted as of this month. We have had have training with the police force and a couple other NGOs, particularly concerning this law, sensitizing people to what's in this act, because it's everybody's business. So, for example, when the products come into the country, GRA has a part to play. When also Guyana National Bureau of Standards has to approve the packages and the product that it's suitable for sale in Guyana. Then you have the health inspectors that should be monitoring what's being sold at the point of sale. Then you have the Ministry of Health that's doing its part to sensitize persons about smoke-free zones. So that's working on the end of helping with smoking cessation and training of healthcare workers and implementation staff. Then you have, for example, the Ministry of Education that is ensuring that these smoke-free policies are well learned by the public, and that persons are aware of their rights as citizens to a smoke-free zone in a public place, in a public office, in public transit, any public indoor space. So the agencies involved here are many. It's not the policeman's law to enforce, or it's not the GRA's law to enforce. And with that, I call out to all the community stakeholders, community groups, religious groups, NGOs, CSOs, and the smaller bodies of authority within the nation to really police their area of influence, to ensure that that tobacco is being regulated, that tobacco control is existing in their part of Guyana. One of the major challenges we are facing right now is the point of sale advertising, and that's something that I believe that will be a focus for us where we're concerned, the implementation of the law on the non-medical end of tobacco control.
You gave us quite a mouthful there.
I can break it up for you. Just let me know which part was interesting to you.
No. It's quite a mouthful, but it's interesting indeed, because we spoke about smoke-free zones, and you spoke about the task force. But the task force, I understand every the council would have to have some form of backing in terms of support. Where does the council get its support? Is it adequate enough? Because you spoke about having all these stakeholders involved. What can we do? What can the ministry do to get more people involved in this fight against, to regulate tobacco use?
Right. Thank you for that question. You know, it's really I am looking at it from the standpoint of a person who really wants to see this law be successful in this country. There really is a need for tobacco control in this country. And I'll come back to what I said. It's everybody's law, so that the Ministry of Health, even though the minister is the ultimate person who must ensure that this law is enforced, the Minister of Health, it's a multi-sectoral involvement and input that is required. And worldwide, it's quite well known that not enough money is placed into tobacco control, because the tobacco industry is so rich. They have so much resources, so that tobacco control, the kind of resources we're operating with, cannot compare. However, that being said, our council was really a body of enthusiastic persons, and they got much done despite little resources. And the commitment from these organizations continue to be there. I mean, even the recent activity that we had Ministry of Education came forth with their representatives and facilitators, and so everybody, I feel the atmosphere for getting this the active is there, and so what I would say to you is that the resources are not there to match the work that has to be done, and it cannot lie with the council. The council is more of a strategic body and a counseling body. However, the major part of identifying the violations, bringing it to the attention of the council, sensitizing the public, that's everybody's business. And this is why we need to continue the work of sensitizing the public and persons and agencies of influence that can sensitize and educate our public.
We mentioned NCDs earlier. I don't want to tie my tongue again. So, could you expound on, because we spoke about the harmful effects and some of the illnesses. In this time, we have COVID-19 and that's a respiratory that virus has a respiratory nature to it. So, could you expound more on the NCDs and how the tobacco use and the risks involved in this time that we're facing COVID-19 for persons who smoke?
Right. So let's broaden that category again, because let's just say two persons exposed to tobacco smoke, right? Because once again, it's not only the smoker. What I would say to you is that tobacco use puts a person at increased risk of more severe forms of COVID-19. So it's added to the risk factors. We've seen that tobacco, along with other NCDs, makes the person's disease progress less favorable. So patients who use tobacco and, for example, have diabetes, in general, do not perform as well as persons who have diabetes alone. So that the tobacco smoke really does increase the risk. The tobacco use, really does increase the risk of complications and severe disease, not only other NCD.
Hello?
those persons who are now, we are now in the COVID-19 pandemic, really, you have to take all measures to ensure that you're safe. Get the vaccine, maintain safe distance, social distancing, and also attempt to quit, try to quit. Now is the best time to just not smoke anymore. So because of the nature of COVID-19, that it really affects the respiratory system as well. And the last thing I would say is that tobacco use is everybody's business because of first-hand smoking, second-hand smoking, and third-hand smoking. So that the choice not to smoke doesn't only relieve a person himself or herself from this risk of disease, but also makes the environment safer for others. And so that's where I would leave it. With that encouragement to commit to quit today on the World No Tobacco Day 2021.
Okay, so thank you so much, Dr. Boch. That brings us to the end of this week's program. Thank you for all those who tuned in. We hope that you gain some knowledge and that you can apply to stay safe and healthy during this time. So until next time, we just want to say have a safe day and be good to yourselves.